Well, let's turn now to the province of Alberta, which has become the worst COVID hotspot in Canada these days. It continues to lead the country in the highest number of active cases per capita. Let's take you out to Alberta now. The provincial government asking the federal government, along with the Red Cross, for as many as 4 field hospitals to deal with soaring cases. Let's bring in Professor Craig Jenne from University of Calgary. He's an infectious disease specialist. He's with me now. Good to see you, Professor Jenne. Thanks for taking the time today.
Glad to be with you.
What is happening in Alberta?
Well, we're seeing day after day and week after week of rising viral cases, and unfortunately that's leading to increased hospitalizations, increased ICU admissions, and tragically loss of life over the last several weeks here in Alberta.
Okay, we have the Premier of Alberta, Jason Kenney, looking at possibly turning to the federal government and the Red Cross to try and develop a plan for 4 field hospitals, as many as 4 field hospitals. What does that say to you?
Well, it clearly shows the province is preparing for increased patient burden. Now, we can't imagine we'd be asking the federal government for additional resources unless the risk was real. So either based on current numbers and modeling from the current infection rate, or accurate data from the actual hospital occupancy and current strain on the resources, we know that as we move forward, there is a chance we will exceed our capacity to treat patients with the current infrastructure. So there's a plan put in place, if needed, to build additional bed space for the mild to moderate cases.
So does that suggest to you that it's, as the Premier says, look, this is just prudent planning, we have to look at all options? Or do you think that's where Alberta's headed?
Well, I mean, it could be both. I think it's important to have that capacity if needed, but the fact that we're even in this situation is the very concerning part. We have seen week after week of rising cases, and we have seen the government try to bring in some restrictions, but unfortunately, they at this point have not succeeded in flattening the curve. We brought in new restrictions about a week ago, and so far the early data is that the curve again is not slowing. So we have to be prepared for an inevitable increase in hospitalizations. Unfortunately, people that are infected today, they're not the ones in the hospital. Those people will start to arrive at the hospital 2 to 3 weeks from now. So rising numbers now, we know that the hospitalizations are going to go up. The question is how far.
What can you tell me about the current strain on hospitals in Alberta right now? Are they managing to cope? Are they close to the line?
Well, our frontline health workers are just amazing people. I do not understand or know how they keep going. We have been near capacity for weeks now. They've been unbelievably creative and resourceful in finding additional resources and space, but we also know they're exhausted. Anybody that's had to work in personal protective equipment knows how stressful, how tiring that is. And unfortunately, because it's a virus, it not only targets patients, hospital workers are exposed. Frontline healthcare workers are exposed. They too could get sick, and even if they're not virally infected, they may have to self-isolate because they've been exposed. And this really depletes the workforce and puts excessive strain on those that are still in the workplace.
I think that does raise clearly another challenge that would face the province, right? It's one thing if you need to turn to 4 field hospitals, you still have a staffing issue. I mean, you have to staff those hospitals, and I guess to some extent the Red Cross might be able to help do that. But at some point, the hospital challenge becomes, as you pointed out, right, a pandemic staffing challenge, and that takes Alberta, if that were to happen, to a whole different place in terms of problems, right?
Yeah, and that one is a little less predictable than physical space, right? We see the infection rates, so we know approximately how much physical space will be needed in the coming weeks. But an outbreak or 2 outbreaks can have a massive impact on the HR availability. And that is a very dynamic number, and that is much more difficult to plan, other than we simply know where we are today is already straining the system. So many more problems are going to really challenge our ability to have adequate staff for not only the current beds, but any expanded beds.
I think 2 questions kind of go in lockstep when people look at this and say, I guess in a lot of ways, how did we get to this point? And the other part of that is, was it preventable? Did Alberta have to be in this situation?
Yeah, I mean, these are really tough to answer because what we do know about the virus is that there's never one answer. There's never one simple solution. That where we are today is a combination of probably a lot of little things. Unfortunately, I think the real tragedy here is that unlike what happened in April and May, we knew this was coming, right? That we were no longer really guessing about the virus. Early on in the pandemic, where a number of centers had to potentially look at expanding hospital capacity, we simply didn't know what the pandemic was doing. We did not understand the dynamics of this virus. We've now had 9 months or more, and the cases in Alberta, as well as Ontario and Quebec, have been growing for the last couple months and growing at almost a predictable rate. So this is really the unfortunate part, is that this should not be a surprise to anybody, that we have seen it coming, and through the various measures we've brought in, they have not been successful in limiting the spread and containing the outbreak.
So let me finish on this then. Are there, I guess, more stringent measures that can be adopted now that can try and arrest this? Or is it now predetermined to travel a certain course now, even with new restrictions?
Yeah. So unfortunately, it's a bit of both. Things like hospitalizations and ICU, many of the patients in the coming weeks are already predetermined. Those are people that are infected now. What we do need to get ahead of is this rising case number. And in particular, we do understand that there's a significant threat with the holiday season coming. After Labor Day, after Thanksgiving, we saw spikes. We saw increased numbers of patients. And unfortunately, we have no reason to believe that the upcoming holidays through December are going to be any different. When people gather indoors, gather in groups, virus numbers go up. The question is, can we bring in any additional measures right now to limit that? And how far are we willing to go? We do have to keep in mind that we have to balance not only the virus, but all other aspects of healthcare. And that's something that, again, I think we're slowly losing traction on, where we are now delaying and deferring surgeries for other patients as well as COVID.
All right, lots to deal with in the province of Alberta, as the rest of the country deals with COVID-19 as well. But Professor Jenne, thanks so much for your time today. Appreciate it.
You're welcome. Take care.